Advanced Healing Techniques is a collection of gentle moves for the experienced massage therapist, body worker, or chiropractor. They have been collected and modified from various disciplines, including chiropractic, cranial osteopathy, orthobionomy, and polarity therapy, and are useful for sports injuries, whiplash, headache, and lower back pain. The techniques presented here can form a treatment in itself or may be added individually to your repertoire of healing skills. We'll start this tape with a quick scan of the back, which helps to determine where the trigger points are and the tight muscles of the back are located. This is Amber, who's a massage therapist. I'll be teaching her the moves as well as having her demonstrate and learn them. So the quick scan, we start at the suboccipital muscles, palpating for trigger points. There's one right there. Then we come down the extensor muscles of the neck. There's another trigger point there. And this only takes about 30 seconds usually, and then we palpate the trapezius. There's another trigger point. And then we come down the erector spinae muscles, circling around the shoulder blades in the teres major and minor. This next move is the erector spinae Z and iron. We're going to iron out the tension. So first you move up the spine, and what we're doing is using opposing thumbs, one going up, the other down.
And exerting a fair amount of pressure, it looks like.
Yeah, and it's a stretch here too.
Okay. So you're not actually working on the spine, you're working more right into the muscle.
Yeah, right in the erector spinae muscles here. The next move is sports massage, very useful for working with sports injuries. So let's say that we're working with this muscle here. First you do origin insertion work, and you rub quite vigorously on the origin and the insertion of the muscle. You can find out where these are in an anatomy book. And then you do a poking and rolling motion here. The next aspect has to do with transverse frictional massage. Then we palpate for trigger points. There's one right here. Reinforce your finger. This crease in the thumb gets reinforced with the next finger. Then we have the next aspect, which is soft tissue fixation mobilization. First we check the motion of the muscle, checking horizontally, vertically. It doesn't move well in this direction. Then the last aspect is fascial stretch. So we're going to just go beneath the skin, not quite to muscle, and check the motion. It's restricted right here. This next move is from Jinshin, and it helps to relax the spine and help someone go to sleep. This next move is called the stick shift release, and it's from orthobionomy. It's great for releasing any trigger point from the crease in the knee all the way up to about T2 in the spine. This can also help the lumbar vertebrae move back into place because bones are moved by muscles.
Right, good point.
It's very useful. And it's great for people who had a low back injury as well. Now I'd like to demonstrate the scapular rotation move from polarity therapy. The rhomboid muscle right here, which we'll be working with, is a muscle of respiration. So once it's freed up, the patient will be able to breathe more freely. This move is called the polarity toe stretch. Now in polarity therapy, let's have you bend your knees, please. Each toe represents a different element. So there's the earth element for the small toe, the water element for the next toe, the fire element for the middle toe, and the air element for the next toe after that. And this is the ether toe right here. And they represent different emotions as well. And it's a tingling, kind of like electricity. And then there's a point right here on the chest. And again, we move the energy up.
Are you applying a lot of pressure, just basically gently?
It's a gentle rocking kind of pressure. It's called Rajasic.
Okay.
There's three types of touch in polarity. Rajasic is this moving touch. Then there's a light, barely touching, which is Sattvic. And then Tamasic is the deep touch.
Okay.
Now I'd like to introduce non-force and reverse foot reflexology. Non-force foot reflexology has to do with torquing the foot in a position that allows it to release without using pain. Reverse foot reflexology allows you to treat the body and get rid of the pain that's on the reflex points on the foot. So first we'll find a reflex point on the foot here. This next move that I'll demonstrate is a figure-8 movement on the bones of the foot. This helps to adjust the bones of the foot, and it's great after spraining an ankle or spraining one of the bones in the foot. Now I'd like to demonstrate a way of moving the knee that releases it, and it's from osteopathy. Next, I'd like to demonstrate the lumbar stair step and figure-8. So bend your knees, please. Each segment of the stair step is a different part of the lumbar spine, and the sacrum as well. Right here, it's the sacrum.
Now, is that actually causing an adjustment in the spine, or is it working mostly with the muscles around it?
It's more working with the spine.
Okay.
So it's very good for people that have recently injured themselves. You can go very gently. It's much more gentle than a chiropractic adjustment. It can prepare for a chiropractic adjustment as well. Now I'd like to demonstrate the use of the principles of orthobionomy working with the diaphragm. And working with orthobionomy, we don't use much force. We just put it in the position that allows the body part to release. Now I'd like to show the North Pole stretch from polarity therapy. This is an excellent neck stretch. This move is called ear balancing. It's also from orthobionomy, and it helps to relax jaw tension and tension around the ear. The cranial hold for whiplash is very useful for a patient that just was in a car accident. It helps release very deep layers of tension that they might have. So again, we're going to be working with the occipital region right here, very bottom of the skull, top of the neck. Next, we'll be doing a series of cranial relaxation holds that are excellent for ending a massage with. First, we go under the supraorbital ridge, and it's just a gentle tugging, very soft touch. Tug towards your body. And then we go to the mastoid process. That's right here. Mast means breast, oid is like, so it's just behind the ear. There's a bone. It's the mastoid process of the temporal bone. This is an extremely powerful point and can put the angriest man to sleep in a few minutes. Just keep holding that, and very relaxing.
I imagine these would all be good for headaches, too.
They do help with many headaches. In this tape, we've shown a variety of techniques from a whole range of different disciplines. I hope these general release techniques will help you and your patients achieve a happier, healthier lifestyle. Thank you.